Sarah Smith is a 25-year-old Gravida 1 Para 1 who had a precipitous, unmedicated, normal spontaneous vaginal delivery of a 4550 gram infant boy at 36 and 1 weeks gestation. Her EBL was 450 mLs. Sarah had an uncomplicated pregnancy but was hospitalized once for asthma 3 years ago. Her baby is in the special care nursery for observation, accompanied by her husband. It is now 90 minutes after delivery and Sarah just voided 600 mLs. Sarah is sitting on the side of her bed and starts to feel dizzy.
Okay, now that you've eaten, gone to the restroom, emptied your bladder, why don't we go to the NICU to see your baby? How do you feel about that?
But I feel very dizzy right now.
You do?
Yeah.
Let's get you down.
Okay. Oh.
Okay, let's lay you down here.
Okay.
Cover you up.
Oh, I feel something's coming out.
Things coming out? Okay.
Yeah.
I'm going to check your
Oh.
focus.
Oh.
Okay. Yeah, you've got quite a bit of bleeding.
I
Okay,
do?
so I'm going to call for some help. Okay. So I'm
Oh.
just going to be pushing on your uterus to make sure that it's okay.
Oh.
Hi, can I help you? Hi, can I please have an extra nurse and a doctor to LDR 9, please, for a hemorrhage?
Management of postpartum hemorrhage includes assessing bleeding with fundal massage, vital signs such as blood pressure, heart rate, pulse ox, fluid bolus, and oxygen via face mask as needed for comfort.
Okay, so there's going to be another nurse that's going to come in and start an IV, okay?
Okay.
All right. Continue to take some deep breaths. I'm sorry that hurt. Hi, Eva. How can I help you? Hi, Steph. This is Chu. She's having a little bit of extra bleeding.
Okay.
I think she's having a hemorrhage.
Okay.
Wondering if you could set a second IV started.
Absolutely.
Okay, so she just delivered a little bit ago. We just got her up to use the restroom, and now her fundus is boggy.
Okay.
Okay. I'm so sorry.
Hi, I'm Dr. Thompson. What's going
Hi,
on?
doctor. This is Mrs.
To maintain effective communication between providers, SBAR should be used.
Sterile gloves.
Of course.
Crystal, I'm going to check you, okay? Check your bleeding.
I have the wall clot.
A wall clot is a bedside clotting test in which you take 4 mLs of the patient's blood in a plain red top tube and tape it to the wall. Failure of a clot to form after 7 minutes suggests coagulopathy.
And then if we could double the Pitocin.
Medical treatment of uterine atony includes bimanual compression and massage of the uterus. Medications used are oxytocin, methergin, misoprostol, or hemabate.
She does have asthma, so we won't use hemabate.
Okay.
It is important to maintain awareness of contraindications of these medications. Postpartum hemorrhage is a blood loss of greater than 500 cc's after a vaginal delivery and greater than 1,000 cc's after a C-section. Traditionally, blood loss is estimated. However, this method tends to be inaccurate. Therefore, it is imperative that healthcare providers use methods such as weighing and measuring to determine blood loss.
All right, she's starting to firm up a little bit. What's her blood pressure?
It's 120/80.
Okay. All right. So your bleeding has stopped, okay? All right, and we're just going to continue to monitor. All right. How are you feeling now?
After patient's condition stabilizes, maternal vital signs are assessed frequently according to individual clinical situations. This includes vital signs and non-invasive assessments of cardiac output are obtained frequently to observe for signs of declining hemodynamic status.
Hey babe, the baby is great. Whoa!